City Manager D. Williams-Ridley and Berkeley Health Officer Dr. Hernandez regarding our response to the COVID-19 pandemic. And before I turn it over to our health officer, I want to take a moment of remembrance in honor of George Floyd, who we know was the victim of a vicious murder at the hands of the Minneapolis Police Department. Our heart goes out to the family of George Floyd, and people all over the country are grieving and are angry, including here in the city of Berkeley. We must continue to fight for racial justice and for liberty for all people. And our country is suffering with two diseases, racism and COVID-19, and we must fight both. We know that COVID-19 has disproportionately impacted African Americans, Latinos, lower income households, and other communities of color. And it is actually evidenced even in our own city. There was a recent map that was released that showed the 94703 zip code, which is principally in South Berkeley, has been hardest hit by COVID-19. We must address the racial disparities in our response to COVID-19, including focused testing and focused health services to make sure that we are ensuring that all people are safe in our community. We will today update you on our response to this pandemic, including plans to modify the shelter-in-place orders, plans for expanded testing, including focusing on our nursing homes, and other updates around city operations. And so with that, I'd like to turn it over to our City of Berkeley Health Officer, Dr. Hernandez, to give us an update on the number of cases, as well as update the Berkeley community on any information around our response to COVID-19. Thank you for joining us, Dr. Hernandez, and thank you for your tireless work on behalf of our community, and particularly your concern for addressing the issues of racial disparities in how COVID-19 has impacted our community.
Thank you, Mr. Mayor. I couldn't have said our concern and my concern personally about the impact of both diseases on our community. And unfortunately, they're intertwined. It's really no surprise to me and to many health officers and healthcare providers that we are seeing an increase in cases in the communities of color, because this disease has amplified those lack of access to services, lack of access of culturally competent services to our communities. And we continue to focus on providing outreach to those communities and plan to redirect some of our testing into those communities. And I'll talk a little bit about that in a second, but I just wanted to acknowledge and thank you for those words. It is something that we have seen, and definitely we are not unique in the city of Berkeley. So when we look at our cases in Alameda County, there are now 3,194 confirmed cases of COVID-19 in the county, with 94 deaths. In the city of Berkeley, we have 93 cases and 1 death. In terms of our tests reported to us on City of Berkeley residents, there are 2,776 tests that have been performed and reported to us, and the percent positive is 3.4%. Last week, I talked about our indicators and our progress report that we have, and I wanted to talk about those 5 indicators that we're tracking. Our communications team is working on having a document that we will have posted on our website that will show our progress report, but I wanted to go over those indicators very briefly today. Our first indicator is cases and hospitalizations, and we want them to be flat or decreasing. At this point, we're not met. We're seeing both increases in cases, which we expect because we are increasing testing. We're also expecting that because of the relaxations in the shelter in place. What we are tracking closely as well in that first indicator are hospitalizations. And that continues to rise in Alameda County and in City of Berkeley residents. So we're seeing increased hospitalizations in both in the community. In terms of hospitalizations, when you look at the data from Alameda County, fortunately, if you want to see a bit, right now it's hospitalizations are rising. Hospitalization and admissions to intensive care is not. We're still tracking that, but it's mostly people being hospitalized, still very, very worrisome. The second indicator is hospital capacity in order to meet our needs in the community, and that is looking at all the hospital capacities throughout the county. That has been met. We have sufficient capacity to meet the needs of the Berkeley community for COVID and non-COVID hospitalizations. The third indicator is testing capacity. That has not been met. However, as the mayor has alluded to, we are increasing our capacity. We're averaging over the last 7 days, 85 tests per day. And that is an increase from the last report. So we're working very hard to increase the testing capacity within our jurisdiction. I'll talk more a little later. Fourth indicator is sufficient case investigation, contact tracing, isolation, and quarantine capacity, basically our public health workforce. That has been met. We have trained both case interviewers and contact tracers in our city staff. And we have deployed some of our healthcare volunteers, and we have been phasing in that staffing, and we are currently have that staff, and we're also meeting with those 4 indicators where we're supposed to reach a 90% goal of all those cases reached, cases isolated safely, contacts identified, and contact safely quarantined. So we're either at or above that benchmark in that indicator. And the last indicator is our personal protective equipment. And there's 3 components to that, and we have not met that. While the hospital has certified that they have sufficient personal protective equipment, our healthcare facilities have not. And quite honestly, the biggest need in our community for healthcare providers are gowns. Everything else, masks, respirators, we have that ability, is just the gowns. And we are searching both as a city as well as a operational area, which is our county, for those gowns, and we're getting them as soon as possible. So I wanted to talk a little bit about shelter-in-place orders and the relation between these indicators. These indicators help guide us to see how we're doing in our relaxations. And it's not an all or one. So if we're not meeting testing capacity, or if we're not seeing a flattening of our cases, it does not mean that we're not going to relax. We will relax, but we're going to do it cautiously. We're going to do it slower than what the governor has allowed us to do, because he is looking at the whole state. And when you look at the state data, you see that there's areas where there's increased cases and hospitalizations. And one is the Bay Area, so that's ourselves included, and Southern California, LA, Riverside area, in there. So we are going to be slower in the Bay Area. However, we are going to move to relax. Our hope is to first increase the face covering requirements, where we're going to ask that everyone, or require that everyone wear a face covering no matter what when you go outside and you're in public. There will be some exemptions. Most of them are going to be based on healthcare restrictions. And that is something that is consistent with the last face covering order. In terms of our shelter in place order, we're hoping to expand our activities for childcare and camp activities for all children, not just those of parents that are returning to work. We're also looking, as was announced, curbside library services, which is something that we want to do. And the last, we're looking at the concept of social bubbles, and looking at having individuals outside of households being able to socialize outside, not inside, but outside. And when we look toward other relaxations, we're really looking at some opportunities and activities outdoors. Right now, what I'll say is that we're hoping to relax on those measures that I've outlined and defined, And then in the next weeks to months, we'll look at outside activities. We're looking at a full incubation period before we make those changes because we want to look at the impacts. In terms of the skilled nursing facility outbreak that we're managing, we continue to work very closely with that facility. There have been 2 rounds of testing in that facility, and there have only been 2 confirmed cases that have been reported and identified with those testing. We will continue to work and support that facility. They are currently not accepting admissions, and we will work with them to allow them to safely admit additional residents there in the future. But at this point, that is not allowed. We are still continuing to monitor that facility and finishing up with testing. In terms of this long-term care facility support plan that I outlined last week, we are continuing and on target with our testing. The long-term care facilities we've tested in partnership with healthcare providers, testing 4 out of the 6 facilities, both their staff and residents, and there have been no confirmed cases from that testing. We will finish up that testing next week. We're also meeting with the facilities to work on their mitigation plans. One of the facilities is not required to have a mitigation plan, but we're working with them nonetheless to ensure that their residents and staff are protected. The last thing is about expanded testing. We are hoping to expand testing to anyone in the city of Berkeley at our test site. We're working to support our healthcare providers so that they are able to test. We're waiting for testing kits from the state. We have not received those yet. We do not have a cache of testing kits in our warehouse. The testing kits that we have, the testing that we're doing is with in partnership with the IGI lab at UC Berkeley, and those are the kits that we are using. Otherwise, we do not have a cache of kits. In terms of other testing, we're hoping to have another site. I'm working tirelessly with the state in identifying and with our partners in Alameda County, and I hope to be able to have more news on that in the next coming weeks. And I'm going to stop there now and turn it back over to you, Mr. Mayor.
Thank you very much, Dr. Hernandez. I think it's important to state that while we are exploring the modifications of some of the restrictions in the shelter-in-place order, we need to do so cautiously. I'm very concerned about the increase in cases in Alameda County. There have been recent news reports that Alameda County has seen the biggest surge in the Bay Area. Obviously, that is due to increased testing. You will see more cases, but we do not want a surge of new cases. And we know that COVID-19 will be with us for a while until we actually have a vaccine that's available for mass distribution. So any easing of restrictions is going to result in more cases, but it is important that we do so based on the indicators that Dr. Hernandez had outlined. We do so cautiously. I know our businesses have been very challenged by the restrictions that have been put in place, but we are working to ease those restrictions very thoughtfully. I know our community has really been challenged by sheltering in place. And I think as we discussed at town hall last week, and that was Memorial Day weekend, people are feeling a bit restless over having to shelter in place. Families who have to assist their children with distance learning while also working, it's been challenging as well. We know that this has not been easy. Families have not been able to see their family members. I have not been able to see my family members as much as I would like to because of the sheltering in place restrictions. But it is essential that we continue to shelter in place and follow the restrictions because it is important to help our community fight this virus and also to help prevent a surge of cases like we've seen in New York and other jurisdictions. We got a lot of questions around masks, which I'm sure we'll talk about, particularly concerned about people not wearing face coverings when they're outside. And I think this new order, which I believe is going to go into effect next week, will make it very clear when you leave your house, except for very specific medical exceptions, you must wear a face covering. And I think that will provide a sense of security for people in our community. who are walking in close distance to others and also help reduce spread. So I want to thank Dr. Hernandez for her work. And with that, I'm going to turn it over to our City Manager, Dee Williams-Ridley. And good afternoon, Madam City Manager. And if you can please give us an update on city operations and any other information we'd like to share with the Berkeley community.
Thank you. Thank you again, Mr. Mayor, for your opening comments. I do want to make a few comments about it because the killing of George Floyd hits my home more than you can even imagine, and the homes of many women and men of color that live with young people. I have two sons that one's the age of 15, one is 21, and the conversations that I've had to have over the last few days have been so heartbreaking for my friends and family, and especially my children. And it's hard to explain why we're still here today and having the same conversations over and over again about racism and why, you know, to change where we are, it takes change in the heart. And I don't know how to explain that to him in any way that takes him away from thinking about, you know, trying to make a difference in a way that's violent. And I'm saying that's not what we want. But what we do want is for all of us to keep pursuing the elimination of racism. It is destroying our country and who we are. So I just wanted to make a few comments about that and to thank you for your opening comments. As the Berkeley community may know and or may not know, but our police department was deployed yesterday evening to Oakland as a mutual aid request. And all of our values, our training, and the way that we care for our community was taken with them. They are participating in a mutual aid request for which Oakland and others also participated. At least 6 different jurisdictions were participating in supporting Oakland and keeping their city safe, and also keeping the demonstrators safe in terms of their free speech and being out there and doing the right thing. We had people there were people that were marching, that were peacefully marching, and then you had others that were contributing to the destruction of the community. So I just want to thank our police departments and the surrounding jurisdictions for supporting the demonstrators in the best way that they could, and also to put a few words out there that I hope they all stay safe. With that said, I want to thank the mayor and Dr. Hernandez again for their time today. I want to give a couple of updates on operations. So 3 things. Number 1, all of Berkeley employees have returned back to work, will return back to work on June 1st. What does that mean for you as a community? Our actual departments and buildings are not quite open yet for direct service, but we will be considering when to open up all City of Berkeley offices moving forward. There are still critical and essential functions that can be accessed through appointment. So please contact our city if there is an essential or critical need that you have. So we're still able to provide service. A lot of our services are online at this time. So we do encourage you to use all of the technology to acquire the service needs that you may have. On June 1st, as the employees return back, we will still have a number of employees that are teleworking and a huge number of employees that are still being deployed as disaster service workers to respond to the pandemic. So anticipate that it still will look isolated and desolate in the area, but people are working from home and people are also going to be working from the office. The second thing I want to update on is the wildfire preparation that we're doing here in the city. We are working with Alameda County and PG&E in looking and preparing for wildfire prevention and also for minimizing public safety shutoffs within our city. And so we're doing all of the planning now. And as you recall, our EOC is an active part of the planning for that preparation. So again, as we look at the deployment of our employees and the operational capabilities, we will have multiple things going on: power safety shutoffs, as well as responding to the pandemic for COVID. So I don't anticipate changing our EOC operational delivery drastically, but we will address and adjust as needed. At this time, again, a lot of our services are tied to the pandemic. So we don't have a lot of ability to shift our staffing to assist in other operational needs within the city at this time. And then lastly, I wanted to just share some information about domestic violence, because I think it's important to share with everyone the resources that are out there. According to the National Domestic Violence Hotline, California is in the top percentile of COVID-related calls in the nation. The state has announced a new initiative to support victims of domestic violence amidst the COVID-19 pandemic. These efforts include additional state funding, expanding a text to 911 capability to 75% of the state, and partnerships with Airbnb and Uber to provide transportation and accommodation to domestic violence victims. Anyone experiencing domestic violence should call the state's 24-hour hotline at 1-800-799-7233 or the national hotline, which is 1-800-799-SAFE. So I just wanted to put that out there for folks that need that resource. Thank you, Mr. Mayor, and I'll turn it back over to you.
Thank you very much. I know that an issue we've touched upon previously as well is how the sheltering in place and, and people who had family members who contracted COVID-19, who died due to COVID-19, the incredible emotional toll that has on families in Berkeley and throughout the country. And that it is just as important to protect your mental health as it is to protect your physical health. And so to that end, the city's website, cityofberkeley.info /COVID-19 has information on a variety of resources available for people who would like to access counseling or mental health care during this time. And I want to read the mental health crisis triage line, which is 510-981 5244, 510-981-5244 for people who would like to access services. So please, please care for yourself. It's just as important as caring for your health and caring for others. So with that, we received a number of questions today, and I'm going to dive right into it. And the first set of questions I'd like to direct to our city manager. And first question is around childcare, around plans and timeline to reopen childcare facilities. And I certainly know that as part of some of the recent announcements that we've made around summer camps and childcare, that there's some news that we can share on that. Madam City Manager, I believe your computer is muted.
Thank you. Thank you very much. So yes, Mr. Mayor, we do have some great information and great news about childcare. And I know over the series of meetings that we've held with the community during the town hall meetings, we haven't had much robust information for folks. I do want to allow the health officer to share what the plans are for childcare, and then I will provide some resource information as well. So Lisa, I'm going to turn it over to you at this moment.
Thank you.
Sure. As I mentioned in my opening remarks, our plan is to open childcare for any child that can or any parent that wants to send their child to childcare camps, any sort of whether it's daycare or camp activities, any sort of activity they will be allowed to do that, still using the same restrictions outlined in the previous orders for those that were allowed to send their children. With a stable group of 12, the camp or the activity has to be for no less than 3 weeks. And there's certain restrictions in terms of that group staying stable, not mixing with other groups, and there being hand washing and other screening activities that would be there, both for the staff as well as the children that are attending those facilities or those programs. And then hopefully with the social bubbles, that would be another opportunity for more informal types of social activities for children. We're still figuring out the details on that, on how that will look for the city of Berkeley, but we're hoping to have that released as soon as possible, hopefully this week coming. and there'll be more information, and we can talk more about that in the next town hall, but that's coming soon.
Wonderful. Now, we've gotten a lot of questions from parents around, can groups of kids kind of self-isolate and play together? And so that will be welcome news for our community.
Soon.
Wonderful.
So thank you, Mr. Mayor, and thank you, Dr. Hernandez. So in terms of resources, we have an online portal for locating childcare, and that is online. And if you can visit City of Berkeley's website, workers seeking childcare options can use a state portal to also find safe, reliable, and accessible providers. And that is located at mychildcare.ca.gov. And it offers interactive maps of available qualified licensed providers based on location, child age, capacity, and type of care. The tool is available also in English and Spanish. Again, that's mychildcare.ca.gov. Also, the CDC has helpful advice for caretakers of children. During COVID-19, the guidance offers tips on teaching and reinforcing everyday healthy behaviors, keeping children active and socially connected, and helping children cope with stress. So there are a lot of resources. Just reach out to our website and also to the mychildcare.ca.gov site so that you can find out available licensed care providers. Thank you.
Thank you very much. Next question is around city commissions. And I can address this question. When the declaration of emergency went into effect, the Director of Emergency Services did make a decision to limit City Council Policy Committee meetings and commission meetings, only those that had essential business or legally mandated business. And for the most part, that is still in effect, with some exceptions, with some commissions that have budget oversight, as well as commissions that do have essential business for city operations. We're not quite ready for every single one of our 40+ commissions to meet yet, mainly because our staff are busy responding to the COVID-19 pandemic. Staff being redeployed as disaster service workers to assist the city in a variety of efforts. And it is more important at this time, just as our democracy is important, it is more important at this time that we ensure that our staff and our focus is on how we address this public health emergency. So there was a question around crime. Has there been an increase in vandalism or property damage at businesses since the shelter-in-place order went into effect? And I know just that our conversations with businesses, we sadly have seen an increase in vandalism, particularly in our downtown and Telegraph Avenue corridors.
So yes, as of mid-May, based on call for service data, which is clearly preliminary at this point, but our calls for service continue at elevated levels of approximately 150 per day. Very few calls now are about shelter-in-place violations. The majority of calls are about disturbances, welfare checks, suspicious people and circumstances. Robbery and aggravated assaults continue to be much lower, and our overall violent crime is down by 16%, but that's likely due to so few people being out and about. The burglaries are also down about 18% as people are in their homes. However, where we're seeing the increase is auto thefts. They are way up. We had 25 in the week of, I think it was May 10th alone, more than twice the week previous. So increases in petty theft and grand theft, they're up about 12% year to date. And then of course, grand thefts, including catalytic converter thefts, they're continuing to rise. Auto burglaries are increasing due to the shelter in place, and we suspect that many of those may not be reported, as mentioned during my last update. The large increase in property crimes year to date has our property crime rate up nearly 9%, with about 1,352 incidents thus far compared to 1,243 last year. We are returning to our normal patrol deployment, which is tomorrow, Sunday, and we'll have more people on patrol in downtown for our task force. We responded again to Oakland's PD request for mutual aid last night, sending commanders in 3 teams. One of the very experienced commanders said it was the heaviest amount of police confrontation and destruction that they've ever seen. But we are still protecting Berkeley and making sure that we are supporting and being available for our community as well, and calls for service. I think that's probably it for now, Mr. Mayor, unless you have more questions around.
No, that's very helpful. Thank you very much. A couple of questions around enforcement. Specifically, can the city take action against small corner stores that are allowing people to enter without masks and in great numbers? And this individual is seeing this happen regularly throughout the city. We encourage you, if you are seeing a violation of the shelter-in-place order, to contact the, I think the police non-emergency line, correct, Madam City Manager, 981-5900?
Correct.
981-5900, or you can email covid19@cityofberkeley.info with specific questions around the regulations or any enforcement issues, and a city staff person will respond to you directly. Yes.
And we do anticipate that there will be greater calls for service around the face coverings once we issue the SIP. So we'll be thinking about how to work in the community better. So one of the things that I wanted us to do was to deploy monitors, because I think that's having eyes out there and encouraging people, having additional masks on hand to provide people with in case they just don't have the ability to have one or to obtain one. So we're going to continue to figure out how to make sure that happens. And I know, and thank you, you've talked about putting together a campaign around what do we need to do to elevate the messaging around facial coverings. So I'm gathering we'll be working together on moving something forward here in the near future so that our community can stay safe.
Stay tuned, Berkeley, for that campaign. We need to rally as a community. We'll get through this together. Next question, I think we addressed this in Dr. Hernandez's comments, is are we going to implement a mandatory facial covering rule like San Francisco? Yes, that will be forthcoming, and I think it is appropriate. Homelessness. Why is the city allowing RVs to shelter in the city? Will we provide waste dumping facilities for RVs that are parking in the city? I could kind of open on this, then turn over to you, Madam City Manager.
Thank you.
The CDC guidelines say that it is actually worse to disrupt people that are sheltering who do not have permanent housing, because it could spread COVID-19 or make those vulnerable populations more susceptible to spreading COVID-19. We sadly know, due to our broken economic system, that we have people in our city that do not have permanent housing. That will be even more acute after this pandemic. And so we must continue to do what we can to end homelessness. That must be a priority. You do see more RVs parking on Berkeley streets. You see people living in tents on our streets. I know that it may be jarring for people, but please know that this is safer than having people out in the elements spreading or contracting COVID-19. That is following CDC guidance, which is something that many other jurisdictions are doing. Now, the question around a pump station is a good one, and the city has allocated money for that. And that will be something that we will continue to explore. But as part of our new normal, sadly, seeing people living in tents on our streets is part of our new normal. And I personally think, speaking for myself, it's better to have people shelter in a tent than to have people out there exposed. Recognizing that we do not sadly have enough homes for people to get them off the street. Our commitment will continue to be to get people off the street. But we have to have compassion and patience and understanding as well. Madam City Manager.
Thank you, Mr. Mayor, for those comments. Absolutely. I just want to add on that we've placed additional hand washing stations and porta potties throughout the city. There are more than 20 public restrooms available, and we're all observing a shelter in place. So we've got to figure it out together. This includes people living in RVs, but the city will develop a fixed site pump out station as we bring staff back into full operations in the coming weeks. We will continue to look at the opportunities to develop a fixed site to handle pumping out of the waste from RVs. So I just wanted to provide that information. But for now, our restrooms are available for folks.
Yes, that's right. And there's a map on the city's website. You can go to COVID-19 or cityberkeley.info/COVID-19. And there is an interactive map that has all of the public restrooms and places where portable restrooms and hand washing facilities have been installed in the public right of way.
Thank you.
The question around how much have we spent around homelessness. I know that we're still compiling the numbers on how much we've spent in responding to COVID-19. We've had to move some money, such as some of our state homeless emergency aid program funds, as well as federal CDBG money and ESG money that we received to focus on our response to homelessness. On average, we spend around $18 million in direct services to the homeless, the most out of any jurisdiction in Alameda County. And with Measure P, that provides around an additional $6 million a year. As we're approaching the budget process, we'll be looking at all this. How can we make the best and most effective use of the local, state, and federal resources that we have to provide shelter and services to homeless individuals in this public health emergency?
Yes, and just to add on the types of services, and I think people are aware, but I just want to reiterate, we're providing everything from shelter, housing support, showers, meals, basic living support, mental health, public health needs. And so it is a huge deployment of service delivery. And that service comes from both your police department, your fire department, your public works, parks, legal, 311. Those numbers aren't included in the data. But at this point, we are all hands-on organization when it comes to supporting our homeless community. And I know we're experiencing very visual homeless needs out there, but please know that we are out there, we are working with people, and we are supporting them. So thank you, Mr. Mayor. I think you covered everything. And yes, we will be having conversations at our budget meetings with council and with our budget and Finance Policy Committee. So I invite the community to chime in, to tune into those meetings so that you can hear and understand what the budget is and how we're moving and advancing. There will be a dedicated conversation about our unhoused community in terms of setting the stage on what services the council would like to see continued as we continue to build our budget. So thank you.
And I think I want to highlight before I go to the next set of questions, the article that Berkeley side recently published, and I want to thank Berkeley side for their excellent ongoing coverage of the COVID-19 emergency. An article they published around the program that the council just funded this Tuesday that we are implementing to provide shelter in trailers, 18 trailers, as well as in a city-owned house in West Berkeley for people to safely shelter off the streets. Now, we certainly need to help more people, and we are continuing to identify other opportunities to expand shelter. But I just want to highlight and thank the staff and thank the Berkeley Food and Housing Project for helping get that program up and running so quickly.
Thank you.
Moving on, library. We talked about the fact that curbside pickup of books will now be something that will happen. I know many of us have been hungry to check out books from the local library. I've been certainly ordering a lot on Amazon and keeping up with my readings. So that is coming soon. And thank you to the Berkeley Public Library for helping implement that program.
Yes, Mr. Mayor, if I can comment. Yes, the Berkeley Public Library Foundation just gave $15,000, and that will help them to actually implement the curbside service. So I wanted to mention that as well.
Thank you very much. That's a really great gift from our Public Library Foundation to support that effort. There was a question around, what is the city doing to ensure that essential workers, people that are most in contact with individuals like grocery workers and other, non-medical essential workers, that they have access to facial coverings. And I know that our police have face coverings with them. People need them. I'm sure our transit agencies are requiring that their employees are wearing face coverings and providing face coverings and giving face coverings when you go on a BART train. So anything else that you can elaborate on around how we can make sure that our essential workers get access to face coverings?
Well, certainly all of the City of Berkeley employees have access to PPE and facial coverings. So every particular staff member has a particular need around the PPE, the protective equipment. But in terms of the community at large, so businesses like grocery stores and different entities, a number of things are happening there. So employers are providing their facial coverings for their staff, but they're also putting things up like plexiglass in areas so that it protects people as they're coming in and allows the movement and the flow a little bit greater for the public, and they feel a lot safer from the actual customer as well as from the grocery store attendants. So I think what I'm seeing is the availability of hand sanitizer at these locations where it allows people to wipe down the carts or to wipe their hands as they're entering stores. And then all of the things that help people contain their distance or maintain their distance, like X's, marks on the ground and the sidewalk, showing people where to stand. Those are things that help support it. More than just wearing a facial covering. So there are numerous things that are happening in different stores that are having access by individuals. So those are the comments that I would share this time, Mr. Mayor.
Thank you. And specifically, this resident had asked about N95 respirator masks. We are not encouraging people, unless you are medical personnel, to wear N95 masks. Those should be available, and if you have them, to donate them so that they can be used by frontline medical staff and other people that need to use them because of the national shortage of those specific types of face coverings and masks that people need.
And also, Mr. Mayor, those types of masks require training. They require you to be trained in how to utilize and secure them. So I just want to encourage people that the facial coverings will help with the droplets. That's what we're trying to avoid, having people produce these droplets into the air. So.
And if I could say one other thing and highlight what you have just mentioned, Madam City Manager, is that these face coverings are protecting others in the community. It's not a personal protective equipment. It's actually for you to protect your fellow Berkeleyan or whoever you meet out in the community. So it's containing, as you mentioned, your own respiratory droplets. The other thing I want to mention is when you're looking and selecting a face covering, do not use those with a vent on them. I've seen them so many times. Unfortunately, I've had extra face cleaned and extra coverings to hand out to individuals. Those ones with those vents, it looks like a little quarter size plastic portion that's on the face coverings, are not protective. They allow you to release respiratory droplets out into the air, into the environment, and that is exactly what we don't want to happen.
Yeah. And there are many different websites you can go to buy really cool face coverings. So even though you have to wear a face covering, you could kind of jazz it up and wear something really cool. I, for one, I have my UC Berkeley face coverings. So lots available from local Berkeley businesses as well as available online. Certainly wearing face coverings, it is something that requires us to adjust to. But know that this is something that we are going to have to do for the time being. Even after people go back to work or some of the restrictions are lifted, I imagine that face coverings are going to be something that we are going to have to continue to wear. And I think we're going to have to get used to having a face covering with us as much as possible, having it in our purse or having it in our bag or in our pocket, especially when you're coming close to people that aren't in your household. That is one of the things that you can do to protect yourself and to protect other people around you. So swimming. We are not quite ready, I believe, Madam City Manager, to reopen our pools. So I don't know if there's anything else you'd like to add. I know we addressed this at our last town hall.
Right. So no, we are not quite there yet, but we're going to be cautious about how we reopen, especially large group gatherings. That is what I understand is stage 4 from the governors in terms of large group gatherings. And at this time, I think we have other activities that people should engage in, especially as we start to ease outdoor group gatherings. And there will be opportunities for people to get together without being in the pool, unfortunately. But thank you.
And I can add one thing. The health officer group is looking at swimming. We'd love to include swimming into the activities that are permissible with our shelter in place. But in fact, the governor has not allowed it. It is one of the activities that is not permitted under the governor's stay-at-home orders. I have swimmers at home, or here at home, who would love to get into a pool and back to practicing. But at this point, it is not even allowed by the governor.
Thank you.
Mm-hmm.
Moving on to some health-related questions. First sort of batch of questions are on cases. I guess the first question was around the fact that local newspapers reported a jump in the number of cases this week in Alameda County. This question was asking if you have any sense, Dr. Hernandez, around why are we seeing this jump in cases, particularly in Berkeley? Is there particular places where people are contracting it more? I know that we're tracking, data, and we're going to be reporting more data when we can around specifics around cases in Berkeley. Some specific information we can't release under HIPAA. So wondering if there's anything you can add on that.
Sure. I could say first, I'll speak to Alameda County as a whole. From what I understand from speaking with the health officer, they're dealing with a number of outbreaks as well as individual cases increasing in work sites or in facilities. So their numbers are also influenced by the fact that there are outbreaks where there's groups of individuals that were exposed at a specific site and are getting the disease. In the city of Berkeley, we have that one outbreak at the skilled nursing facility, and as reported, there were just 2 cases. An outbreak is considered in a skilled nursing facility as defined as 1 case. So there were 2 cases identified there. In terms of the numbers and what we're seeing in the city of Berkeley residents, it is people who are out either at work or are exposed in the new relaxation orders, and they're bringing it to their household. So we're seeing that one person brings it home. They're not able to isolate, sometimes because they're the caregiver of young children, or the young child has given it to their family. But oftentimes it's happening in the household, and it's and that's what we're seeing. I do anticipate there being outbreaks in work settings as we move into allowing those activities to increase. And we're instituting the recommendations by the governor in terms of having safe workplaces, as well as out and settings in the public, in terms of screening and increased cleaning of those facilities. The face coverings will allow us to continue to move with those relaxations and help contain the chances for having increased numbers and outbreaks.
Thank you. Next set of questions is around the racial breakdown of COVID cases in Berkeley. I believe that Latinos are most disproportionately impacted by COVID-19 in California. But we know nationally African Americans have been most disproportionately impacted by COVID-19. It's not a surprise that people that have less access to healthcare and may have underlying health conditions due to systemic racism are the most likely to contract this virus. And I think it's evidenced by the broader health disparities that we have in our community are manifesting themselves in how COVID-19 is playing out. There were some specific questions around the number of African Americans who've contracted COVID-19 and what's being done to do targeted testing for that particular population in our community.
Sure. So I've got the numbers for Alameda County. Our data is fed into Alameda County's numbers. And of the reported 3,289 cases in the county, the highest number is exactly as you mentioned, Mr. Mayor, in Latino population, where it is at 1,368 cases. The next group actually is a group that's considered unknown, and that's at 603. And what does unknown mean is that essentially when those reports are provided to the county or to the City of Berkeley Public Health, there isn't a designation of race or ethnicity. Sometimes it's a lab report. Lab reports are, we're hoping that labs are better at giving that data to us, but lab reports don't necessarily have the ethnicity on there, even though it's required by law, and then also the reports by provider. So that 603 is in that group that would be dispersed into other ethnic populations if we had the data. I know for ourselves, I can't necessarily speak for Alameda County, but I'm sure that this is our normal practice, is to try to find that information out as we do the interviews with the cases. The next populations are, in terms of numbers, are Asians. Asians are at 448% of the, number of cases, and Caucasian whites are at 387, and African Americans are at 289% of the cases that are been reported in Alameda County, and that's at 11%. So I reported those numbers in terms of rank, like where they are in terms of numbers reported to us. In terms of what we're doing in the city of Berkeley, we're hoping to get our test site to be mobile, to do more testing out in the community, in focused areas, and hopefully in partnership with local organizations that serve the population, hopefully with our religious leaders. Those partnerships we're hoping to strengthen and work with doing some testing in those areas in the coming weeks.
Thank you very much. There were a couple of questions around the Elmwood nursing home facility. We touched upon the fact that testing of all the residents and staff has already occurred, as well as ongoing testing at all the skilled nursing facilities in the city of Berkeley. There was a specific question, Dr. Hernandez, I know that you received around the California Department of Public Health reporting at some of these facilities. And I'm not aware of that information, if there's anything that you might be able to add on that.
It's required that all skilled nursing facilities report their cases daily to California Department of Health licensing and certification. So there is an actual, I believe it's an online report that the facilities are required to submit daily to the skilled nursing, to the licensing and certification at California Department of Public Health. And there's a website that has all the data, and you can look up each of the facilities to see if they have reported cases. If the cases are less than 11, it says less than 11. They're not going to give individual numbers for that small of numbers. And that's a decision based on by the state, as well as what is typically done for reporting of small numbers, such as they've decided 11, sometimes that's 10, but that's typical. So that's something that we can all look at if we want to see information about how our facilities are doing statewide and also within the city of Berkeley. You just look by name.
Thank you. And Dr. Hernandez, you had reported that when we did the testing at the Elmwood facility, there were no other residents who had tested positive.
Yes.
And that at the present time, based on the testing we're conducting at the other nursing homes, that there were no other positive cases of residents at nursing homes in Berkeley.
Residents and staff. So
yeah.
They're both being done. And this is the first baseline testing. And after that, they're required, these facilities are required by licensing and certification to do routine surveillance testing. What is recommended is that they do basically monthly testing of all staff and residents. We have offered to those facilities access to our test site for them to send their staff to the test site. We would help with scheduling and getting them tested in that week, in that monthly testing. So that is something we started with this campaign of testing that we will complete by next week. And then we're also offering the facilities the opportunity to have their staff tested at our test site. That is not a requirement from the state to us as in public health. It is a requirement for the facilities to get their their staff and residents tested, and we know that it's a heavy lift for them. And we are offering this testing through our test site free of charge to them.
Wonderful. There were several questions around certain types of activities like going to church and barbershops and other activities that are currently not allowed, and why we have not yet allowed those types of business activities or social activities to occur when other states are doing so and other parts of this state are doing so. I think it's important to emphasize that while the state of California is moving ahead in providing guidance and allowing certain activities to occur, ultimately the decision is a local decision. It is a decision of our public health officers in local jurisdictions. And the Bay Area is not quite where the state of California is. And that is because of the data and making sure that we can handle what we anticipate to be a surge in cases, and that we're doing so safely. So to those questions that were asked, we're not quite ready to open up barbershops, although I encourage you to cut your own hair. There are lots of YouTube videos you can watch about how to do so. And we're not quite ready to open up churches and allow other types of social activities. But please know that we are thinking about this. We're planning for this. We're considering this. And we want to do it right, and we want to do it safely. There were a couple of questions around house cleaning. Once again, I know that was some questions we asked last week. When will we allow house cleaners to come to be able to do business in homes? I don't believe we're quite there yet, but Dr. Hernandez, anything you can add?
Sure. House cleaners can come for those individuals that need help maintaining the cleanliness and safety of their homes. So if an individual needs help because they cannot perform it, not because they don't want to perform it. I hate cleaning my toilets. That's my least favorite thing to do. However, I'm doing it. That's my activity for Saturday. But really, seriously, if someone cannot perform these activities and they need help in the household to ensure that they have clean environment, that is permissible, has been permissible for the last several months. I believe it was even included in my first shelter-in-place order. But for everyone else that wants it, it is not time yet. In terms of religious services, I do want to say that we know that is an important activity. And right now, it is not permissible. However, we are considering in some time outdoor services. My theme is things will happen outdoors first before we move things inside, because we know the risk increases in a big manner once we go indoors. So hopefully in the next month or so, we'll see other activities outdoors, and religious activities are one of those ones that we're hoping to include.
Thank you. Some of the questions you had addressed, Dr. Hernandez, in your initial comments, like the social bubbles, which is something that you're exploring and that we'll hear about soon, which I know that many families are particularly interested in finding out about. The indicators that we talked about, I know that we have been tracking our progress in meeting those indicators, and we've developed a dashboard. Are we anticipating to make that dashboard available for public viewing? In terms, I know we have a dashboard around cases, but around where we are meeting the indicators.
That's my plan. The communications team is working on a document that is public facing. I have my internal one that the public health team put together. It's quite lovely, but I'm not sure if it's ready for prime time. It looks better than the one I had last week, I promise you. So this is this is my document. Something of that effect will be available for the general public soon. And I know that our communications team has that as one of their priorities. The other thing is looking at how we're going to move forward with the shelter-in-place relaxations. That's something that hopefully we'll have a document as well. I don't think we'll call it a phase because then it gets confused or thought it's very similar to the governor's. Our path, it will be more of a pathway as to how we're moving forward. That's going to take some time, but we're definitely know that we want to communicate this information out to the public so they are aware of how we're doing it, how things are going, and where we're looking toward in the future. But again, we're going to be doing it cautiously and at a different pace than the rest of the state.
Thank you very much. There's a question on parking tickets for street sweeping. I know we've touched upon this before. We do have to continue to do street sweeping in order to meet certain legal mandates to ensure clean streets and reduce pollution in our waterways and in our bay. And that does mean that you have to move your vehicle. So we are asking for voluntary compliance, at least spend 5 to 10 minutes to move your vehicle to ensure that we could do street sweeping. If you do get a ticket and you are facing economic hardship and you cannot pay it, I do know that people have been able to contact the city manager's office to request consideration of whether that citation could be waived. But we are asking, if you are not able to pay your ticket due to economic hardship, that in those instances that you do consider requesting relief. And please do move your vehicle. We need your assistance and cooperation.
Thank you, Mr. Mayor.
Testing. We talked about testing. Is COVID-19 testing available for asymptomatic people? If yes, where? I believe we're not there yet. But I don't know if Dr. Hernandez, if there's anything you can update us on this week.
Sure. In terms of testing asymptomatic people at our test site, we are doing just high risk settings and individuals. That includes individuals, all the staff from the skilled nursing facilities. They're being tested, whether they're symptomatic or not. Individuals that work in shelters and transitional housing facilities, they're allowed to get testing, and we've had some of those individuals get tested. Encampments are being tested both by our homeless outreach team and the street medicine team through Lifelong Medical. There's also testing that's available in other sites that are throughout the region, and you can look at our website at there's a California COVID testing locator, and if you look at the City of Berkeley test site, which is cityofberkeley.info/COVID-19.testing, there's a description on who can get tested at our test site, and that number is 510-981-5380. And then there's other opportunities and as I said, a link to the California COVID testing locator, where you can see testing sites throughout. And some of those are testing people who are symptomatic or asymptomatic, and you do not have to be a resident of that city or county. They're open to all. So that's one thing. We're hoping to open up our test site in the next week or so to add anyone within the city. Again, the way to access that testing will be at our test site with that phone number, the 981-5380, but that is not happening yet at our test site. We'll announce it as soon as that's available.
Thank you very much. I'm so pleased to hear that we're working on expanding access to testing to anyone in our community that needs to access it. And I really appreciate the efforts to ramp up testing availability in our community, which is an essential indicator for us to be able to track and to safely reopen our economy. Next set of questions are really questions I'd like to address. This constituent talked about BART's financial crisis and how this may impact BART's plans to pursue transit-oriented development, and how can we ensure that we'll protect Berkeley constituents in discussions around development on BART property and ensure that contextual housing is built that fits into neighborhoods. I just want to acknowledge that we're launching the community advisory group for our BART station planning. Actually, I believe this, not this week, but the week after, they'll have their first meeting, virtual meeting. We encourage all Berkeley residents to participate. We've launched a new webpage for information on our BART TOD planning process. The work does continue. And I will just say that, given COVID-19, we need people to be able to safely shelter indoors and in homes. And we had an acute shortage of housing in the region before this pandemic, and it's even more acute now. And we need to continue our efforts to build more housing, particularly housing that is affordable for low and very low income households. So that work is continuing. We are launching the community advisory group process, 15 amazing Berkeley residents and leaders who are going to advise us on the future of our North Berkeley and Ashby stations, and please stay tuned for information on those processes. There was a question on regulations around commercial evictions, and I would like to encourage people to go to the City of Berkeley's COVID-19 website, cityofberkeley.info/COVID-19, for information on resources that are available for our small businesses, including the regulations the City Council has adopted to, one, prevent commercial rent increases of more than 10% during the local state of emergency, and two, to prevent evictions during the local state of emergency. The local state of emergency is still in effect. There is no time frame when it is going to sunset. It is an action taken by our city manager and ratified by council. And we will continue to evaluate whether the local state of emergency should continue based on the conditions that exist in our community and whether it is necessary to help protect the health and safety of our community. But those protections for residential and commercial tenants against evictions are in effect now. Open streets, Madam City Manager, wondering if you can update us on the Open Streets program. I know we're ready to launch this next week.
So for the Open Streets program, we're very excited. Our Economic Development Department, along with our Planning Department, Parks, and also our Public Works Department, we're all collaborating together to determine need and resource. We're trying to look at a two-phased approach in terms of what can be done now, how to get people prepared, because most things will require a permitting process, but we're trying to see what can we do if the shelter in place is lifted, what can we do prior at the time that it's lifted, and what can wait to be addressed. There will be things like zoning adjustments that need to be made, or permitting requirements that we'll maybe bring to council to actually loosen up some restrictions. I know that ABC, Alcohol Beverage Control, has loosened up some restrictions in terms of outdoor alcoholic beverages to be in outdoor spaces. So we're going to be collaborating also with transit, transportation, public works, as well as our economic development. And we'll be working through how to launch those programs. So thank you.
I believe the 1.5 miles that we will be closing for people to get outdoors and to—
if you were speaking about the Healthy Streets Initiative, yeah. I'm sorry, I thought you were speaking about the outdoor dining, and we're trying to time the outdoor dining to the easy.
Both are important, but I know that a lot of work has gone in over the past several weeks in implementing a Healthy Streets program in Berkeley, and that we are close to implementing that.
We got to change the names of these things. Okay, so the Healthy Streets Initiative, yes. We will be launching next week the Healthy Streets Initiatives, and working with Walk Bike Berkeley. They have been amazing partners in helping us to lift this off the ground. We've been busy ordering the signage, getting things ready to deploy to the volunteers that are supporting the effort. And also we're looking at how we can expand the closures that we're already planning. So we're excited about it. So look forward to hearing more about that next week. Thank you.
Excellent. I know that our sidewalks are getting a little crowded, and having more space for people to be able to walk and to bike and to exercise in a way that maximizes social distancing is really important. So, so I look forward to the launch of that program. I want to thank staff for all the work in helping put that together in the community. And then the last question is around what resources do tenants have that cannot pay rent because they're out of work? We know that there are an increasing number of people that have filed for unemployment, that have lost their jobs, some of whom work in the food service sector, and they've lost their jobs due to a significant loss of income. Some people have seen their hours cut. City have done several things. And once again, this information is available on our COVID-19 website, cityofberkeley.info/COVID-19. We've launched a housing retention program. And if you are a residential tenant who is having difficulty paying your rent and you need rental assistance, please call the East Bay Community Law Center at 510-548-4040, 548-4040. And indicate that you want to talk to somebody around access in the housing retention program. We have provided close to $1 million in rental assistance to tenants, which also include families of children in our school districts. We know we need to do more. We know that there's legislation in Sacramento to look at strengthening protections and providing rental assistance. And the City Council will also be considering whether to enhance our housing retention program. So there is money available through the housing retention program, and we have just recently strengthened our regulations to provide protections for residential and commercial tenants. So now you cannot be evicted for any circumstance unless it's for health and safety in the city of Berkeley during the local state of emergency. You have up to 12 months to pay back your rent, and landlords are required to develop a rent repayment plan with tenants. And there are many other protections that have been put in place. So once again, please go to our website, cityofberkeley.info/COVID-19 for information on these residential and commercial tenant protections. And we know that this will be an ongoing issue we need to address. And I just lastly want to address the issue of wood burning fireplaces, which is something we've gotten questions about on a number of occasions. And the Bay Area Air Quality Management District has declared a spare the air period. So you are not supposed to burn wood in your fireplaces because the smoke could even add further complications for people who are also dealing with COVID-19. And just to protect the health and the air of our community, please do not burn wood in your fireplaces as mandated by the regional air quality district. So those are all the questions. I want to thank the Berkeley residents who submitted their questions, and look forward to doing this again. I want to announce that going forward, we're going to do this every other week. So do it twice a month. We'll provide information about where you can submit your questions. And I just want to thank our health officer and city manager for once again making yourselves available. I know you're incredibly busy. I know the Berkeley community really appreciates this opportunity to ask questions and to hear from you around the work that we're doing. If there's anything you'd like to add before we close, I will turn it over to you.
Thank you, Mr. Mayor. Just again, thank you to the Berkeley community and to our amazing city staff. This has been a huge marathon for us all. It's hard, it's tiring, and I know people are feeling tired. Just please hang in there. We're working hard together, and know that we are looking to ease appropriately and cautiously so that you can get services that you need. And we're going to continue to work hard for you. Our goal in the city is to provide the best service possible. So you don't want to go anywhere else to receive that service. And I really work hard with our staff and making sure that they understand that customer service is the #1 thing that we can do well. So I want to thank you all for hanging in there with us as we transition, and thank the community for their amazing support. And Dr. Hernandez, my hat's off to you, because your every day is filled with a huge amount of work, and I am profoundly grateful for your service. So thank you.
Thank you. Dr. Hernandez.
Well, I'm going to continue with the theme of thank yous, because I think as Madam City Manager mentioned, this has been a tough time. This will continue to be a tough time, but we have a path forward. We're doing a great job, and we include the community. I feel that the city of Berkeley especially has been very supportive. They are aware and really get the reasons why we're moving in the way that we're moving in terms of helping to contain this disease. It is not the same way when I listen to my colleagues in other parts of the state and nationally. We know that the ideas are different there, and the sentiment is different there. So I want to thank the community for understanding and continuing to understand and to protect each other as we move forward. I also want to thank city leadership, including you, Mr. Mayor, and Madam City Manager, for your support. Again, this is not what we see in other jurisdictions, and I really appreciate that. That enhances and protects the community in the way that needs to be protected as we move forward. I also want to thank the team in the city. Of course, the public health team, the disease containment team, the heavy lift. I am not here alone late. I'm here with a core group of people who are working throughout the city, not only on disease containment, but a group of people that are still working tirelessly. So I want to thank everyone on that team, which is, I can't say hundreds of people. And that's how I'll end it, is just thanking everyone and wishing everyone a good day, and for everyone to stay safe, both from COVID-19 and because of what is happening throughout the nation and region.
Thank you so much. And with that, thank you, Berkeley, for tuning in. Please be safe and healthy, and we'll see you at our next town hall. Thank you.